Dr. Sonish Khatri is a graduate dentist, and he graduated in the Bachelor of Dental Surgery from the Fiji National University College of Nursing and Medical Sciences. He's completed his internship between 2019 and 2020 and has a great commitment to clinical and public health. Dr. Sonish is currently working as a dental officer at the Singatoka Subdivisional Hospital with the Ministry of Health and Medical Services. And the teledentistry initiative in Fiji was a concept of his. So I will now hand over to Hannah to go through with the ceremonies.
I think we're ready to kick off. Dr. Robin, Dr. Sonish, are you good to go?
Yes, I'm good to go as well.
Great. Feel free to share your screen if you want to go through some slides. I'm recording everything as I mentioned, so yeah, happy for you to go ahead.
Okay, no problem. I will share the slides now. Okay, could you please confirm that you are seeing the screen?
We can, yes.
Okay, so good morning, everyone. Good afternoon, sorry, it's morning for me, but afternoon for you. Good afternoon, everyone. My name is Dr. Robin Ohanessian. I'm a medical doctor in public health from France and director of Telemedicine 360. We've been working with WHO Pacific for the past few months in trying to support the initiation of telemedicine in emergencies situation. I am pleased to present to you all today this webinar training session. And please feel free to ask any question at the end. We will share the time between me and Dr. Sonish after on a specific case on teledentistry. So it will be two different sides of the same coin.
Can I just ask everyone to mute? I might be able to mute. There we go. I did it.
Yes, okay.
Yes, sorry.
It's good to start, no problem. So the topic of today is about launching telemedicine in emergencies and low resource setting, and we'll go through those topics. Before starting, I wanted to give a brief contextual approach of the current situation. It's very macro level, it's not detailed, but it's just to give an overall idea of what could be done. So we could see the first step from 2010 to 2020, which was maybe the first real decade of telemedicine and telehealth in the world, with growth everywhere, different countries, but majorly in high-income countries, with different specialties. However, in the Pacific, it was very, very limited. Then COVID pandemic came, 2020, 2021, and we saw a sharp increase of telemedicine activities all around the world, and even more in countries which were already prepared. The question is, where do we go next in the next decade from 2021 to 2030? So there are different scenarios for those countries. It could be stable, increase, slow increase, high increase. Now, if we take a look at the Pacific, actually this sharp increase that was seen in different part of the world was much more limited in the sub-region in the past year. And this is actually what triggered this project to push and promote everyone the idea that it's possible and how to initiate those activities. So the idea, the objective is that it doesn't stay like this red line or maybe this orange line, but really that from now on, the activity will sharply increase thanks to this project and support that is being given to different countries. So health emergency are a good opportunity to start telemedicine activities because health systems are faced with tremendous challenges that needs to be addressed. And in today's world, telemedicine is one of the solutions to address all those different crises, whether it is epidemiology or geographical or environmental, different approach, different problem, but one solution that can help to mitigate those crises. So how do we start? When we have very limited activities, limited infrastructure, limited capacity, how could we initiate those activities? So first, I wanted to go back to the basics for today regarding the teleconsultation. So this webinar will be focused mainly on this topic of patient to healthcare professional consultation and how to implement it in emergencies. So a teleconsultation is a remote consultation between a healthcare provider and a patient, mostly provided via video calls. However, if not possible, or in certain circumstances, if it's more adapted because of technical capacity, then it may be conducted via phone or simply audio, internet audio, or even text, really, if nothing else can be done, or if it's maybe the best option, we can see in different settings, it could be the best approach. So in this situation, there are different possibilities. The patient can be either at home, alone or with his family, or the patient can be in another healthcare facility than the consulting healthcare professional. And therefore, it can link two different healthcare professionals as well from different level of healthcare. In this situation, one simple example is a patient which is located in a remote island where there is primary care center or primary care facility with a nurse or healthcare assistant, and remote consultation is conducted with a doctor from the main city or capital city hospital. This is one of the example that in the Pacific would be maybe one of the most activity. So it can be done with the patient alone, sorry, alone with caregiver or with another healthcare professional. So when it is needed, usually we have questions at starting point of teleconsultation of can I do it? Is it safe? In which situation I can do it? How do I know? And so on. So firstly, we wanted to give you a brief overview of different settings where teleconsultations can be initiated for this purpose. The first one is movement restriction, such as during a lockdown. We've seen it many times in the world and also in the region. There was specific lockdown policies, movement restriction. Therefore, to continue the medical care of patient, it was necessary to implement telemedicine at this point to ensure continuity of essential health services. The second option is emergency situation, when it is not possible for a patient to visit healthcare professional, such as, for example, after extreme meteorological events. And a few months ago, there was a cyclone in Fiji, for example, that disturbed the healthcare services, and that could have been a great options. Another third situation is when physical consultation or difficult to organize due to remote location of the patient in any kind of situation. In routine base, the population lives really remotely, and therefore it's too difficult to organize physical consultation. However, it is possible to do remote consultation, and therefore it should be considered. Another approach is quick medical triage for assessment of emergency situation. And when it is more clinically relevant to do something minimal remotely than to do nothing in that situation. However, this needs to be really well organized to reduce any medical risks. And then lastly, as well, one of the most example that was put in place during the past year was actually patient follow-up with a known patient that does not need a specific physical examination, and that can be better performed remotely, including, for example, for prescription refill, and one project started in the region for this as well. So what are the first steps? So now you have established a different situation. Let's move it forward. First step is to set up a project team. A telemedicine project cannot go forward with one healthcare professional, and you need different people of different skills to make it move forward. So this is really important to assemble the team for the project, especially during emergencies. Secondly, the second step is to check the national regulations. So, are there existing regulations that may impact the services of telehealth? Was there any temporary regulation done during emergency to allow telehealth services to be conducted? This can be done in collaboration with your health authorities, and to ask them what are the possibilities for you to actually start. The third point, uh, yes, could you please mute the microphone of everyone again? Thank you. The third point is to define the project protocol and standard operating procedures, the SOP, to define in details everything that will happen step by step within your project. And this is very important because it's in those details that the project will be successful and clearly organized. And just after, there will be an example from the teledentistry project. And lastly, you're ready to launch, and there are some specificity to be prepared for this. So I will go through those different steps. Regarding the project protocol, what could be included into this to not miss anything, and as well be quick in doing it. So first thing is the project name. It's important to give a name to the project. It's empower people to work on it. A project governance. So who is the project leader? Who is the steering committee which will discuss the project and implement it? What are the medical objectives? Your inclusion and exclusion criteria for the patient, for the team, and the localization. So, for example, a patient with adult patient with diabetes, followed by the diabetes center in the main city and one island. So this criteria needs to be defined. Which human resources will be mobilized? How many doctors? How many nurses? Which technical solutions to be used? whether it's software and hardware. We will discuss that just late after. What is your compliance with current regulations, or at least have a checking of this? Which financial resources you may need and budget, maybe. Some simple monitoring and evaluation plan with key indicators, for example, the number of cases, number of patients, age, sex, type of disease, this kind of information that will allow you to define and follow up what is happening. And then implementation plan, because it is always better to start in a small scale and then extend it later to bigger scale. So those steps should be as well carefully designed. In terms of requirement, so what are the minimal technical requirements to uh, the first point is a working internet connection. That is with different options and technology that is possible. Um, if possible, with at least a good bandwidth. But if this connection is not stable or possible, then video calls should not be uh, the, 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 the priority, and maybe audio or text should be put forward if it's not possible. But to do that, you need to do technical tests in different positions to understand what technically you can do and what is not feasible. So functioning laptops, phone or tablet, computers, you need to check what is the capacity for this. The audio and video, so most of the time there is no camera, microphone or headset, and this is as well important because the quality is usually much better when you have specific handsets. But again, if it is not possible or if it is in real emergencies and you cannot have all of this directly, then you have to use what is available. And then to check as well the hours of power supply or best reception area if there are those kind of technical. So the next step is to get ready to launch the activity. The first point is to choose the software to communicate with the patient. So you have different options, but usually in emergencies in the region, considering that
go back first.
Considering that there is limited software capacity, it is okay to use free solutions, non-secured, such as Viber, Messenger, WhatsApp, and or Zoom. However, the patient consent need to be obtained and informed that this platform is used and that the data are not fully stored in a secured server. But to start, it is better than nothing to support and ensure continuity of health services. Once the project is improved and running, then and there's more capacity and understanding about the needs, then it's easier to update to more specific solutions. Then setting up the hardware, we have seen the computer, phone, audio, camera, microphone to do the checking for all of this. Receive technical training if needed. Be as well ready on a clinical base. So how should I behave for this or that clinical situation? And lastly, perform some clinical test and simulation to make sure that everything works well, that everyone knows what he has to do, and that there is no any remaining errors or technical issues to be solved. Usually, even when we have planned everything and it's okay to start, we usually find some last final errors in these phases. So in terms of organization, practical organization, when everything is set up. So you need to be in quiet location, because if you have noise around, then it will be not a good environment to perform the consultation with the patient. If you are in a room, it's better to have the door closed. Very practical, but this can help. A neutral background is usually preferred rather than something more colorful or distracting that moves, because the patient can then better focus on you and your speech and how the consultation is going. If possible, it's better to have access to medical record. Some of you have electronic medical record, some of you don't have it. If you don't have it, then it is very important to write notes at the end that can be put on in the medical record, paper or digital, after it. Really, it is important to report what has been done in this approach. Always have the patient phone number in case of technical problems as well. So you may call the patient directly if the line disconnects, which can frequently happen. So this is very practical advice to do. And also be prepared to know what to do in case of clinical emergency. So you have a consultation now, and there is an accident, a sudden medical event. You need to know who to call, how to organize in that case. So now that everything is set up, you have set up your settings, your local environment, software, hardware, technical test and training. You will initiate your first consultation with the patient. So how to do it really when we start discussing? The first thing to do is to introduce yourself to the patient, because they may not know who you are. So this is very important. Then ask the patient to confirm that they can hear and see you well, to avoid problems starting to speak and then you realize that they didn't hear you. Then ask the patient to confirm identity. So it can be directly through the video or showing ID maybe. This is at each country level to decide what is the best approach, but at least asking name, first name, last name, and date of birth to confirm. Then get the informed patient consent. I will go through that just after. Ask the patient reasons for consulting, so the same as traditional approach. Assess if there is a clinical emergency and need for physical referral. So maybe you will have a digital consultation and you assess, you feel that this case should not be going forward digitally, but it needs to be directly assessed physically. So then you have to think about that and know if you continue or if you stop. Conduct a medical examination. So the most important is to ask really the patient detailed questions. And for clinical examination, you can use the observation. So if you need to ask the patient, you can put the camera on specific parts of the body. If they need to walk, you can ask them to walk or to observe the breathing, to remove the shirt, for example, and so on. So of course, you cannot do everything that you can do in physical, but what is important to understand is that the teleconsultation objective is different, and is to assess the situation to know what to do next. Does it need urgent referral? Is it okay to be waiting a little bit? Can the case be just treated by questioning and prescribing? this is the assessment. So maybe you need to do prescription or referral, inform the patient and the consultation, and report in the medical record, whether paper-based or electronic-based. So lastly, how to get the patient consent. So this is really important. It is mandatory to perform teleconsultation. You need to absolutely ask the patient consent after informing about what is the teleconsultation and what will happen. There are different ways to obtain it. One way is to obtain it beforehand, before the consultation. It can be done, for example, if you asked the patient previously during another physical consultation. For example, you have a patient and you know that you can do a remote follow-up with him or her for the next time. So you can ask him when you see the patient physically about the teleconsultation and to get the consent. Otherwise, the next step is to do it just before the call. If there is an online platform, then the informed consent can be shared, and there can be a tick, a box to tick, or something to confirm or to write to have this approval. If this cannot be done before, you have to do it when you start the consultation. And you have to inform about the potential benefits, the potential risks, as well as the right of the patient, and including the right of the patient to refuse the consultation. And if it is the case, you have to inform as well that it will not impact the way that you take care of the patient, and that what needs to be done will still be done, but in another way. And then you have to track this patient consent in your own medical record always, because this will be the proof for this. I have a red line on the screen. So lastly, this may be the last step. You finish your consultation and you want to do a prescription. So maybe in some countries it's possible or not possible, but we wanted to share with you just simple ways that you may be able to do it. So you can either write down in a Word format or use a prescription template. For example, the project discussed after they did it this way. Convert it to a PDF file and send it online. The first option is you send it through a secure portal if you use a secure platform, but most of the case in emergency setting or initial phases of project, there will be no such secure platform. So therefore, you could send it via the chat if it's through platforms such as Viber or Messenger, but always ask the patient as well, because it's as it's non-secured platform, it's important to ask that they approve for you to share this document on the system. And if it's not possible, then you may do it by email to the patient if they have an email, and again to ask the patient consent. Yes, and so you may have prescription, but you may also have a prescription refill need. And in that case, it's a little bit different because the consultation is dedicated to the refill. And for this, you can follow those steps. So asking which condition the patient has, when was the last prescription and when does it end, how long the patient has been using it, has there been any adverse event or side effect, what was the actual use, overuse, underuse, skipped use, what is the clinical situation, is it okay to continue the treatment or not, is it the same dosage, lower or higher, depending on the clinical situation, and then prepare it and send it as explained before. So the telemedicine is essential to reach universal health coverage and ensure equal access to health to the population. So on those last words for me, I try to keep the time and give some practical advice. You may have questions after, so we can go through it. And just on a positive note, yes, you can do it. Everyone can do it, and this can happen. Don't be worried, and everything will be done and eventually will be happening for improving patient care and reaching as well the patient. So thank you for everything. I'm available for questions just now or after. I mean, after the second talk or later on if necessary. Thank you. Thank you, the Pacific Health Network. Thank you as well, WHO, and especially Katri, who is here for leading this project, and everyone else who participated to it. Thank you, and
Thank
see you.
you. Thanks, Dr. Robin. Appreciate that. I will hand over to Dr. Sonish now, and then we can do questions at the end. I think Davina has been able to ask some of the questions that have come through in the chat. Dr. Sonish, are you ready to share your screen?
Thank you, Hannah.
Thank you.
First of all, I'd like to thank Dr. Robin for the wonderful presentation. Very thorough describing on how we can start emergency telemedicine. Also, I would like to thank Katri as well, and some of my special team who helped make this project successful. I would like to thank Dr. Devina, Dr. Robin, Dr. Rafai, Dr. Amos, who is our subdivisional medical officer, who gave approval to do the pilot study for Singatoka Subdivisional Hospital. Dr. John, he's the CWM senior dental officer. He helped guide us through the project. And also Dr. Nadim, he provided me with some information on the current storage facility for all the documentation and information, and those that are under development. Thank you all for all the guidance and support, and also to the oral health national oral health community of Fiji for encouragement and support of this teledentistry project. Okay. Moving on, I'll be presenting on the teledentistry, which is a pilot framework for Fiji. So this pilot we have started in Singatoka Subdivisional Hospital. So what is teledentistry? First of all, before going into teledentistry, we need to know what telehealth and telemedicine is. Telehealth telemedicine is basically delivery of healthcare services where patients and providers are separated by remoteness, and distance is an issue there. So they're separated by distance, and this can be by either conflicts, pandemics, such as COVID-19, natural disasters, cyclones, or by simple geographical distribution where patients in remote areas do not have access to the healthcare settings. The WHO definition, which is peer reviewed, that was defined in 2010, was telemedicine is the delivery of healthcare services where distance is a critical factor, and by all health professionals using information and communication for exchange of valid information for diagnosis, treatment, and prevention of disease and injuries, and which is for research and evaluation and for continuing education of health providers, all in the interest of advancing the health of individuals and their communities. So right now what we are doing is also part of telemedicine, providing information on how telemedicine is actually works. Okay. So anyways, teledentistry is a part of telehealth or telemedicine. Uh, it can, in some places, in some literature, telehealth and telemedicine, they have different meanings to it. Some literature states that telehealth is of, health information provided in for non-clinical setting, and telemedicine being information provided for clinical care. So just for the purpose of this presentation, and also in that literature where I define telemedicine, they have used telemedicine and telehealth as a synonym, so synonymously. So teledentistry is a domain of telehealth that is specifically devoted to oral health care. So evolution of teledentistry, so, it started off with plain old telephone system where we call the patients. So it started in 1994, where when the Department of Defense introduced the total dental access for the Army. And then later on, it developed into emails, and now we have a lot of, we have smartphones and availability of a lot of technologies. So we also have specific telehealth applications as well, which is dedicated to telehealth. An example of a telehealth teledentistry application is the Smile Direct Club. So it is direct to consumer orthodontics, although it does exist, but there is a lot of criticism and also a lot, it's not really controlled because for orthodontics, the orthodontist needs to see the patient to have the controlled force and all the other variables. Okay. So advantages, disadvantages, and limitations of teledentistry is that it reduces the cost of service. So, for example, for if we are doing remote patient monitoring, we it will cut the cost for PPEs and all the instruments used. It will improve quality of care. We can keep monitoring the patient over time and see how, if the patient is improving with health status, or is it deteriorating and we need to see them. It decreases peer isolation and increases specialist support and education. So in this way, we are able to provide, like specialists are able to provide information and diagnosis uh, for the patient we are seeing. So this means from one healthcare worker to the specialist. There is improved diagnostic services and integration of teledentistry into a better healthcare delivery system, and we are able to manage preliminary emergencies. We can do follow-up review in clinic. A follow-up review in clinic can be avoided by remote patient monitoring, and also most importantly, we are able to provide oral health promotion and oral health education. The disadvantage is that a backup communication system and technical support group is required, and a proper internet connection is needed if we are doing video conferencing. Privacy and security are important issues as well. and there can be chance of misdiagnosis due to technical problems occurring during data transfer, which can lead to malpractice claim. So for this, if we are not able to attain a diagnosis, we can at least make appointments for these patients to see them physically in the clinic. Limitations would be that we are looking at willingness of dentists and acceptability of patients towards teledentistry care. Some of the methods and modalities in teledentistry is the live video, which in telehealth we call it synchronous. So live two-way interaction between a patient to a provider, or between if we are referring to a specialist, live conversation between one health provider to a specialist as well through audiovisual telecommunication technology. Asynchronous is where we forward medical information from one practitioner to a specialist, or when we are storing the information outside the real time or outside the live conversation, outside the live audiovisual technology. Remote patient monitoring is a personal health and medical data collection from an individual in one location via electronic communication technologies, which is transmitted to a provider in a different location for use in care and related support of care. So basically, we are trying to provide all our reviews and seeing the patient from a remote, if the patient is from a remote location, and through the audiovisual technology. Mobile health is healthcare and public health practice and education, which is this is basically all the oral health education and oral health promotion that we can post and give information to our patient or the community. So teledentistry amidst the pandemic, there have been various teledentistry applications that are available, especially in the US. Uh, some of them are Mouthwatch, Teledentrix, Doximity, Dentulo, Smile Virtual, or as I mentioned earlier, the Smile Direct Club. And in some countries that are underdeveloped or where rapid implementation of telehealth is required, or during emergencies, disasters, or pandemic, some of them are Zoom, Skype, Facebook, Messengers, FaceTime, WhatsApp, and there are lots of other options available. But what we need is a communication that has at least end-to-end encryption, so that the information is private between the patient and the healthcare. So Zoom and WhatsApp, they have end-to-end encryption. Viber has also end-to-end encryption. This is an example of this is in Brazil. They are using WhatsApp for their teledentistry care during COVID-19 lockdown. Some of the other examples that have been used is in India. They also used WhatsApp for their teledentistry care. So what we are currently in Fiji doing is using Viber and Google as a platform for teledentistry. So we are using Viber as for communication, the audio-visual communication, as well as chat-based communication. and we are using Google Forms for taking a bit of history taking and some information from the patient. And we are using Google Calendar for all the appointments. So we are replacing the fake books for all the appointments and transferring it into digital appointments. So on the side here, it says WIBA. In WIBA, the media and text are encrypted between the senders and the middleman, which is the WIBA's Rakuten company. That messaging app isn't able to read or see them. So it's not, the information is not stored in the server. If it's stored, it's encrypted, and once it's encrypted and then sent to the, so if the patient sends the information is encrypted in the server, and the receiver receives the information, and the encrypted information is not, cannot be seen by the server. Okay. Anyways, so what, this is a workflow for the community group. We are using the WIBA community group. So in the WIBA community group, the dentist posts all the oral health information to the WIBA community group. And this includes oral health hygiene advice and oral health promotion on how patients can go about using the teledentistry care. And these information are received by community via WIBA. So the advantage of having a community WIBA group is that there are unlimited members. Patients' number is private. Only admins and super admins can post on the community. So for oral health education, for public, and also to provide advice on the current oral health situation. New members can see the chat history, so they will be able to see all the previous oral health education and posters in the community group. Patients' ability to privately message admin for teleconsultation. So it will be a one-on-one conversation with the dentist. And as you can see, all other members, as I highlighted on the picture, they won't be able to post anything on the community. So it's just the admins and super admins who will be able to post on the community group. The accessible, this oral health education information will be accessible from remote location with those with internet connection, and it will allow members to add friends with the invite link or the QR code. So I've added the QR code and the invite link to that. I've also shortened the invite link in case we can use that, the shortened URL and give it to the patient for them to add themselves, or we can ask the patient to give their number, and then with their consent, we can add them to the community group. The patients will voluntarily join the group. So the option will appear on the screen. If they want to join the community, they can tap on join community. If they do not want to join the community, it's up to them. It's voluntarily joining the community group. Okay. So workflow for patient to dentist. So the patient can tap on the name of the group, and they can message the admins or the super admins of the group, and then they can write the chief complaint or request for the teleconsultation from the dentist, And then once we do that, this is an example. So the patient can send a message to the WIBA Teledent community group. They will directly message the dental officer, and then we can do a history taking through Google Form. I've attached a small portion of the Google Form because it has a bit of more details, and then we'll take a consent for them to get teleconsultation through WIBA. And if the patient is underage, the parent or guardian will give consent on behalf. So the checkbox is will validate as a sign of consent. And once we take the history, we can start dental consultation via WIBA, which can be chat-based, or we can do a video call. And based on that, if it is an emergency or urgent or requiring physical examination, we can provide an appointment to dental clinic, which will be added to the Google Calendar. And if the patient, let's say they have uncontrolled BP, uncontrolled hypertensive, or they are not compliant with the medication, we can do a referral to us for medical clearance. Or if the treatment is not within the scope of dental facility, we can refer them to a specialist by sending a message to the specialist. And right now we are on non-aerosol generating procedure due to the COVID-19 situation. Yeah, and if the teleconsultation and our diagnosis, we have come up with that it's a non-urgent or elective treatment, we can provide therapeutic treatment, and an e-prescription can be issued, which will be sent directly to the pharmacist, and we will defer treatment until the restriction lifts. But till then, we can do remote patient monitoring. The main concern why I have highlighted this in red is that if it's a non-urgent, there is also concern that let's say the patient's dental caries, it can later on develop into something urgent because they were not able to get restoration done. So that's something of a concern, and we probably need to look for ways to go around into providing some form of care to at least stop the caries progression. So the Fiji Dental Association is currently looking at ways into finding ways into providing aerosol generation treatment, but looking forward to the documents for the documentation. Okay. Then if they need any medical treatment, we can also refer for any medical treatment. So these are some of the terms for teleconsultation, telediagnosis, teletriage, and telemonitoring. For teletriage, I've not included that part where we can provide screening questions to the patient as well. So before doing an appointment, we can also ask some screening questions about their if they have any symptoms or any of fever, cough, or anything of that sort, our COVID screening questions. And if they are clear of any, the screening is clear, we can then provide an appointment. If there is some symptoms, we can refer them to get a swab test done, and then we can delay treatment. So there might be some changes in the workflow depending on which area this teledentistry is on. But for Singatoka, I think this workflow is going well since there are no cases of COVID-19 here right now. So workflow for specialist consultation. So this is our existing Western Divisional Oral Surgery Group. So it's from dentist to the divisional branch WIBA group. We will forward the information to our specialist oral surgery group, and we will provide the patient with a referral letter to transfer from hospital in case of emergency care. Okay. Oops, sorry. Okay. Referral to medical officer for medical clearance. So the dentist we will use this form. The dentist will send the e-referral form for medical clearance to the medical officer in charge for the patient's nearest health center. Then the patient will declare if the patient is fit or unfit for dental treatment, and then this form will be sent back to the dentist. Electronic prescription. These can be sent directly to the pharmacist in PDF or photograph form. This is an example. This is a fillable PDF that has been created. So all the information will be filled in this form. For electronic appointments, a PDF appointment card can be given. This is an existing appointment card that we have. Together with this appointment will be added to the calendar, the Google Calendar, and we can also send ICS calendar file, which can be sent via Viber or email, which will be added to patient's calendar as well. So then the patient will be notified on of their appointment before their appointment. So let's say if they have an appointment of 9 a.m. tomorrow, we can set it to 1 day early reminder, and the patient will be reminded that they have an appointment tomorrow. The teledentistry consultation details. This is a fillable form in the Word document. So this can be printed and attached to the patient folder or stored in the GovNet connected computer when accessible. So teleconsultation details then can be transferred to our PETIS Plus system or oral health information system, which is still under development. For monitoring and evaluation, so this is for all the community. So when I post something on the community, so if I do one post per day, I'll just write one here. If I do 2 posts, then I can write 2. So the community reach is number of views, that how many members have seen the post, and the community support is how many people have reacted towards the post. Further on, this is actually done in an Excel file. So further on, for this part is the teleconsultation part. So we have name, the national health number, which is our PETIS Plus number, the date of birth, and all the other details. So let's say if the type of service will have a list down box of either if it was a teleconsultation, teletriage, or remote patient monitoring. If we have done any video call, yes or no, for emergency or non-emergency, if it was an emergency or urgent, or was it an non-urgent care, or was it elective? So an example of this is that there's a 7-year-old boy who was diagnosed for exfoliating tooth. His front tooth was shaking. So that is a non-urgent care. He wasn't in any pain. So the treatment plan was self-exfoliation. Since the patient was in no pain and we asked him if he wanted any painkillers. He said no, so that's all right. So no painkillers are given. Appointment or referral, there was no need for any appointment or referral, or there was no need for teleconsultation with a specialist. And then we can do remote patient monitoring in 2 weeks' time on how he is doing. Issues. Another example for this one is this patient came for temporary filling, and treatment plan was for remote monitoring and appointment once treatment gets back to normal. So right now, the issue faces that the treatment is limited due to restriction in service. So way forward, the current teledentistry method can be adapted with telehealth and telemedicine as an emergency or rapid implication, while developers and ITC work on developing a government-based secured application. So something like telenutrition or online physiotherapy, NCDs, mental health, which can expand this teledentistry method can expand into those areas as well. So we can, for example, from teledentistry Singatoka Hospital, we can change it into telehealth Singatoka, and we can adapt telenutrition, online physiotherapy, and with NCD, something like an outreach, something we do in community outreach of providing awareness to the community and patients. Alternatively, another thing we can do is with teledentistry, it can grow into national teledentistry Fiji to provide widespread teledentistry service in Fiji. A similar workflow and concept can be adapted in future, and continuous improvement and quality training will be needed for advancement on this project. This is a good project for beta testing on how telehealth can work, acceptance of the patients in Fiji, and willingness of the clinicians in Fiji. Teledentistry will evolve from this concept, and all efforts should be made to document all processes, divergences, convergences, and synergies to strengthen this innovation. I'll just share an example of how I have documented the hold on. Okay. So for the document of the teleconsultation, I keep it password protected. So all the information, at least it stays confidential. Even editing is password protected, so no one is able to change the details of the teleconsultation. This is a 7-year-old boy. He sent a video actually to me of his tooth shaking. So that's how I knew that the tooth is shaking, and we used Google Forms to take history. So these are a checklist. We take medical history taking through Google Form, photographs for assessment. In this case, there was a video sent, Treatment plan made. Yes, we made the treatment plan. Oral health hygiene advice was given. Patient consent was taken. Diagnosis attained. It was a chat-based consultation. There was no medication or e-prescription given. The level of care was non-urgent. There was no medical history. So these are some of the dental history. We used this SOAP method: subjective history of chief complaint, assessment, diagnosis, and treatment plan. And was any appointment given? No appointment given. Yeah, that's it. Going back. And then these are just my references. Thank you so much.
Thank you so much for that. That was great. I'm conscious we've gone over time. There's been a lot of questions in the chat. Do we want to take the next 10 minutes for any other questions and then leave it there? Or is there anyone want to jump in and ask any questions through either chat or just jump in now? Feel free.
Hi there, this is Dr. Jimmy from Vanuatu. I just wanted to ask about the triaging I saw in the Viber group. Who does the triaging, and how is the triaging done to then determine what goes to forward a case forward?
So, the dentist who is providing teleconsultation, they will be the one who is going to do the triage and provide an appointment. So in this case, we are also going to ask some screening questions on if they have any symptoms or anything like that. So in that way, we can determine if they are going through COVID pathway or the non-COVID pathway. So either way, they will, when they arrive at the hospital, they will go through the fever tent and get triaged there as well. But at least this way, we are aware beforehand if they are going through the COVID pathway or non-COVID pathway.
Thank you very much. Thank you.
Okay, thank you everyone. Any more questions before we wrap it up? And just so you know, I'll send around an email tomorrow with a link to the slides that were presented today. So you will have a record of those so that you can refer to them, which will be, I'm sure, very helpful for everyone. Okay, any last minute questions? Okay. I think we're all good. That was great. Thank you to both of our presenters. They were really informative. I'm sure everyone found those very informative. So I just want to say thank you to both of you for your time and your efforts in putting those slides together and presenting. I'll be in touch later today to get a copy of those slides for the email. But we do have another one tomorrow, which Dr. Robin's going to be joining us to present that as well. So feel free to join that if you're available. Anything else from anyone?
Yes, Hannah, this is Robin. Just I didn't mention it before. We wrote it in the chat, but I just wanted to say it orally as well for everyone to know. So if there is any requests for support for WHO, Katri Concho is the lead officer to contact, and her email was written in the chat.
Yes, and another thing is when I send the email out tomorrow, there will be an email address for Finn. So if you do have any questions, specific questions that you'd like to ask, both our presenters or Katri, you can email them through to there, and I'll be able to pass them on. So yeah, you'll get that email tomorrow. So thank you, everyone. And hopefully I'll see some of you then. And we'll wrap it up.
Thank you.
Thanks all.
Thank you. Good luck.